Who's got questions? We have questions for our panelists.
There's a second.
Yeah. We'll bring you a microphone even. Yeah, I see one back there. Yeah.
Hi. My question is for our small business representative.
That's you.
I'm the product of 2 lines of small business owners. And in my experience, small business owners tend to be fairly conservative. How do we reach small business owners with a message of a social program like this?
I'll be super honest. Our small business owners are not very conservative, so I don't have a ton of experience in that specifically. But I think the approach for small businesses, again, those that I know and can speak on behalf of, is really about the reason why many people open a small business is because they care about the product or the service that they're providing. And in order to efficiently and positively contribute to their communities, they mostly need an employee or several in order to help get that product or service out to the world. And this makes your employees happier. It makes your employees' lives better. It really should make your life better if you are a small business owner. A, less administrative piece, and B, you're filling the needs of the people who are making your dream come true, including yourself, in a more effective way. So I feel like speaking to that, where it is, this is not something that, it's not something that's trying to infringe on your ability to do whatever you want to do. You can do what you want to do in your small business. The idea of a universal healthcare program of some kind means that there is less administrative needs on the small businesses. That's what that means. And right now with the 50 people and all that, there's a lot with that. So if you're in that small like we are, very small, yeah. It still should contribute to the well-being of yourself and your employees. I don't know how to make that argument to people who don't think that people should have rights and care about people. But I think that's kind of a universal issue that we're facing. So to people who are trying to make a go of it in this environment, I think the basic answer is it's one less thing for you to have to think about. And frankly, that's incredible. I would love one less thing. We'd all love one less thing. And if it's this thing, even more better, because it's better for all of your staff, and it can be better also for them. I don't think there's ever going to be a system where you can't pay for different care, even if we were to move forward with this. You can go somewhere else, you can pay for different care. That's always going to be your prerogative. But one less thing to think about is like the dream of most small business owners that I know. So that would be my argument for them, yeah.
Yep.
I'm Dr. Chris Santos. I'm a pediatrician. I've had a clinic in Frisco for 25 years. And I want to ask Michael about access to specialists and providers between the two programs, Medicaid and Medicare. For example, the children in my community, in spite of the fact that we have 3 multi-provider dermatology clinics in the community, have to travel 80 miles down to Aurora to see a dermatologist because most of my patients are on Medicaid.
So I wish I could speak to the conjunction of Medicaid and rural health care and the hell that causes. I can't. I am, proudly a Denverite. I would love to sort of dig into that discussion about what that looks like in rural Colorado. I actually lived with my mom since the pandemic, but in northern Douglas County, in Parker. But that is, only about a half hour away from most of my docs in Denver. So that's not something that has been a huge problem, but it is a corollary to something that we've heard before, which is that administrative burden has driven administrative burden and moral injury combined have driven a lot of folks out of the system, including my primary care doc. And so my primary care doc happens to have decided to go concierge because he was in a very small clinic, about 4 docs, and one by one, combination of age and moral injury, they were retiring, getting out a couple of years early, and he ended up being the one left. And the only way that he could manage to survive with the billing, the bookkeeping, all of the administrative things that we were dealing with, that is to go concierge. And so I pay about $2,000 a year out of pocket, which could be a lot worse, but it also is not the system that we're looking for his concierge services. I don't actually see him all that much because thankfully I'm pretty darn healthy when it comes to primary care things. And so that's sort of been my situation. I think that were I to need to travel 90, 100 miles to get to my specialist, especially for neurology, it would be certainly a very different level of pain that I was going through. And that certainly seems to be more what you are describing and what folks, I know where you live, Maddie, I know where you live, Eileen, our rural folks in the audience, I'm sure are living through an entirely different set of circumstances. But what I can tell you is that a single-payer system would alleviate the burden administratively that forced my primary care doc to go concierge. It was not a move that he wanted to make, but it was a move that the only way that they deemed that they needed to survive. And he's very good, and I followed him. And there's not that many Medicaid docs left, even in a big city like Denver. So you choose what you can choose. I've got a good guy, and sort of been able to suck it up so far. But were I to live other than where I live, it would be much worse.
I have some additional.
Yeah, let me ask Kiara about that. What happens in Rye? Do you have to go into Pueblo? Is that what you do?
I do. I do have to drive to Pueblo, so it's about a 40-minute drive from my house to get any sort of medical care at all. And that is, for me right now at this point in my life, very reasonable. I go to Pueblo to do lots of other things, and it's on my way to the capital, which is where I work half the year. So that's not, for me, it's not a big deal, but it also means that we're losing many of our older community members. And actually the way that I was able to purchase my house at a really discounted rate, amen to that in 2019, was that the people in my community met us. We actually lived next door, and they were moving to Hot Springs, Arkansas, because they wanted easier access to medical care. And Hot Springs, Arkansas actually has really shockingly good access to all kinds of medical care and nearly every specialist known to man. And that's actually how they picked the place they moved to. So they had to leave our community to go to a place to get the care they wanted after having lived there for almost 40 years. And that's not really acceptable. I'm personally grateful, but that shouldn't be how this goes. I will also say on the policy front of the question that you asked, the way that many Medicaid providers, many people choose not to provide Medicaid because of the way that our system is set up. Colorado, please stop me if I get way too nerdy, please. Colorado, through the Department of Healthcare Policy and Finance, sets rates for providers based on the services that they provide per billing code. Those codes are, in some areas, we were able to significantly start increasing them for abortion care and maternal health in the last 2 years, but prior to that, they were some of the lowest in the country, and now we're on the higher end. But that was also a lot of years of people getting woefully underpaid.
Yeah.
So every one of those rate codes, there's a series that happens, and it's a cycle of 3 years. It's called MPRAC hearings. Please do not ask me what the acronym is. I'm even a specialist in this, and I still don't know. You go through these MPRAC hearings. So there's a chunk of benefits that are assessed in one of the 3 years. We just went through this in 2024 for maternal and reproductive health care. I was not involved in the 2025 discussions because that's not my workspace. In 2026, there will be a whole new set of rates that are set. The way that those rates are set is one of the things that determines whether or not doctors can afford to provide Medicaid care. Yeah. This is not because doctors don't want to provide Medicaid care, but you also can't provide care where you're losing money and you're losing staff. So this is compounded by the fact that Colorado is under one of the weirder, more oppressive tax systems in the entire country called TABOR. And at face value, I like the idea of people being able to choose what they want their tax dollars to go to. The underlying issue is that every year we take a step back because we're not allowed to save for a rainy day, and we're not allowed to save for a bad year, and we can't accommodate years of mass inflation. And all of those things are not taken into account under TABOR, so this is personal, I hope I don't offend anybody, but the minute that somebody gives you an option to repeal TABOR, do it. Do it, because that will solve some of this problem. These things are inextricably tied together, and so to do one thing well, we also have to do other things at the same time. And we have to work on getting you all that are providers the Medicaid rates that you need. I'm more than willing to talk about that with any of you, regardless of your specialty. I've gotten better at it than I ever thought I would need to be. But we are in a budget constraint that is completely untenable because of this system. And we have to change that. Because we shouldn't have to gut education to pay for medical care. We shouldn't have to gut, basic essential services of any kind to pay for the other one. Yeah. We can do multiple things at one time, and we should be able to do that, and Colorado has eliminated that ability.
Thanks. We have another. Maddie.
As most of you know, I tend to look at what is the purpose of a healthcare system. And, when we say what we want to call Medicaid or Medicare, they both suck. The way they're set up now. For Medicaid patients, they have to prove they're poor enough every single month to see if they're going to qualify. And so both systems are horrible. However, there are plenty of systems in the world that are better than this one because their purpose is to maximize the health of the population, which will inherently decrease costs and decrease all the other fallout that we see here. And if we have that system, small businesses will not have to be figuring out what insurance they're going to do every single year and administer them. That will go away. And so a lot of these things that people are bringing up, the 10 essentials are imperative because we are saying what needs to be covered in there. And that includes long-term and home-based care. So, I think that we really have to realize we're really talking about a paradigm shift here. And I really appreciate all you panelists for being here, but I did want to say that.
Thank you, Maddie.
Thank you.
Here, way back there. A couple more. Yes.
I just wanted to build on the small business issue again. In 2016, when we ran Amendment 69, I was a small business owner. And as a small business owner, you're required by law to pay into workers' compensation. And it's about 4%, or at that time, I don't know what, I'm not in a small business anymore. But it's around 4% of the payroll. And one of the big things that Amendment 69 provided for was that you would have a 10% payroll tax. And this covered, a large population. It didn't take into account Medicare and all these things. But for the large population who had a W-2 income, the employer would provide 2/3 or 6 2/3, and the employee would provide a third of the 10% as a payroll tax to pay for universal health care. Well, as a small business owner who wants to provide health insurance for his employees, I think they do. Adding this 2% to the 4% was a no-brainer. And plus, by the time I think Obamacare is required after you get 50 employees or something, you have to provide health care for your company. So anyway, this was just a no-brainer, and that's another, just the finance side of things. It just makes so much sense to provide universal health care. And we already have so much socialized medicine in this country. Anyway, you have the VA, Medicare, and Medicaid, and all these things. So anyway, I was a big proponent of universal health care just from a small business perspective.
Yeah. Thanks, Steve. Steve said the VA is socialized medicine. I'm a Navy veteran. I use the VA, and I'm sitting in the waiting room with the other guys, and I say, this is socialized medicine. No way! I'd never take that. That's what they say.
So my question is about, I know in our organization we've been protesting for trans rights, and one thing that we've been focusing on is that there are different medical systems in Colorado that are trying to abide by Trump's ruling. I'm going to overcome it. He doesn't want trans kids to get covered, and there are some of our medical providers, the UC Health System, to be specific, is kowtowing to this, and I know that the federal funding threats are hanging over their heads, and I guess I'm just wondering, how your organization or other organizations are, considering what to do about this. The federal funding threats are such a big problem in a lot of different areas, but especially for medical care.
Want to take that one on, Emmett?
Sure.
Yes.
Yes. Thank you for the question. And not to go down a mini rabbit hole, but I think also a lot of questions about trans healthcare right now are around trans kids. And it's hard because it's kind of a bad faith question. Sorry, not from me, from people who are well, what about trans kids getting healthcare? So really quickly, just to dispel some myths and give you some talking points if you run into people who are asking those questions. The regret rate for gender treatments is less than 1%. Yeah. The regret rate for knee replacements is 30%. So there's 100 times more regret for a knee replacement than for any type of gender care. Another talking point, cis, being non-transgender, cis people also get gender-affirming care, and I think that's a really big thing that I'm focusing on messaging. Anybody on Rogaine except for me? Hair loss medication? Anybody? Damn, no one. Okay, well, my hairline is, okay, let's go. My hairline is receding, so I'm on Rogaine. But that's gender-affirming care that a lot of cis people utilize. For kids specifically, if you're undergoing what is called precocious puberty, which is puberty that's happening to a child too soon, they go on puberty blockers, which are also prescribed sometimes to trans kids. They're completely reversible. You go off of them, your body goes through puberty. Anyways, so just really quickly, just wanted to say that gender-affirming care, everybody utilizes it. It's only when a trans person is trying to utilize it that it really comes under fire. And then as far as the question of I guess institutions kind of caving to pressure, I think that one of the biggest things is really pushing for accountability within your own institutions. If you don't have a policy for trans patients, if you don't have trans advocates, things like that, making sure that whatever your organization is kind of instilling that role automatically. I do think there has been success in pushing back against organizations trying to make quiet decisions around trans healthcare, and there's been public pushback in which they've at least had to come back and say, here's our reasoning, here's our policy going forward. But yeah, honestly, I would fall back on the fact that gender-affirming care is used by all people. So to ask a question about trans people receiving gender-affirming care is asked in bad faith. I'll stop there.
Thank you. I've been firmly instructed to end this session at noon so we can go to lunch, and it's noon, so I just want to say thanks again to all our community.